So naloxone, also known as Narcan, it's an opioid antagonist. It does the exact opposite effects of opioids. It's used in the reverse opioid overdose effects such as respiratory depression, your coma. That's what you're looking for. If that happens, then you're going to want to administer this naloxone if they were on opioid therapy. If the patient has chronic opioid therapy, think chronic opioid therapy, so your addicted narcotic patients, the patient will have reversal. Be mindful that the patient will have reversal of all the effects that opioids have, which means they are in danger of what? Seizure activity. So chronic opioid therapy patients, and they have decreased respirations, when they are given this naloxone as an emergency stuff, they have to be looking for, hey, they are going to have a reversal of all the side effects, all the reversal of all the opioids. So seizure activity is a high risk for these patients that were addicted to opioids or were on chronic opioid therapy. The dosage needs to be carefully titrated for chronic opioid therapy patients when treating toxicity in opioid addicted patients, and also small series rather than one large big dose helps. Be mindful that the half-life is shorter in naloxone, and be mindful that because of this, the half-life shorter than in naloxone than the opioids, they may need more to bring your respirations back to normal. The nurses needed to monitor for the respirations, and administration for IV. Administration can be IV, it could be IM, it could be sub-Q, but it's not an oral medication. Naloxone is not oral. IV, it almost works immediately, which is amazing for emergency situations, and it will persist for about an hour, so they may need more. So watch for those respirations. Now, it's contraindicated for infants with what? You gotta remember this. Infants that are born to narcotic addicted mothers or chronic opioid therapy mothers. This is contraindicated for. So the baby that has a narcotic mother, what do? You monitor them in the NICU, and you'll be assisting them in breathing until the withdrawal process has occurred. This is really important to know, that you cannot be giving naloxone to these infants born to narcotic addicted mothers. Now, if they weren't born to narcotic addicted mothers and they had respiratory depression, then you can give them naloxone. But narcotic addicted mothers, this is contraindicated, and they will have risk for seizures if they are given naloxone. All right, so that's everything for naloxone, and yeah.